This is a CJSN podcast, and I am Dr. Flory Tsobo Muanda from Western University. On the behalf of my co-authors, I am pleased to present the result of our study, higher dose sitagliptin and the risk of congestive heart failure in older adults with chronic kidney disease. Sitagliptin is an oral dipeptidyl peptidase for DPP-4 inhibitor used to improve glycemic control in patients with type 2 diabetes mellitus. As this drug is primarily eliminated by the kidney, dosing guidelines recommend a reduced dose for patients with moderate to severe chronic kidney disease to prevent harm. In practice, sitagliptin is rarely started at a lower dose in this patient, and no clinical studies have compared outcome in patients with chronic kidney disease who initiate sitagliptin at a higher versus lower dose. Some evidence suggests that sitagliptin is associated with a higher risk of congestive heart failure in the general population. Our population-based study from Ontario, Canada, consisted of 9,215 older adults with type 2 diabetes and an estimated glomerular filtration rate less than 45 milliliter per minute per 1.73 square meter, but not receiving dialysis, who were newly prescribed sitagliptin between 2010 to 2017. We compare the 1 year risk of death or hospital admission with congestive heart failure in outpatients starting oral sitagliptin at greater than 50 versus less than or equal to 50 milligrams per day. We also compared the risk of hospitalization with pancreatitis or hypoglycemia, all-cause hospitalization, and glycemic control between the two groups of sitagliptin users. We found that 71% of sitagliptin users in Ontario were prescribed a higher than recommended dose. The 1 year risk of death or hospital admission with congestive heart failure was not significantly different in patients starting sitagliptin at greater than 50 versus less than or equal to 50 milligrams per day. Furthermore, there was no association with the sitagliptin dose and the risk of other outcomes, including hospital encounter with pancreatitis or hypoglycemia. We observed that patients who started sitagliptin at a higher dose achieved better glycemic control and had a lower risk of being admitted to the hospital. In summary, we found that starting a higher than recommended dose of sitagliptin in older adults with chronic kidney disease was not associated with significant harm. This finding suggests that sitagliptin dose reduction may not be needed in patients with chronic kidney disease. However, our findings should be confirmed in study before acting upon such information.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.